I wanted to take a few minutes and talk a little bit about total motion release or TMR and how it's affected the way I treat patients. I first started studying TMR in 2009, and over the last, I guess, 11, 12 years, TMR has had a big impact on the way I treat patients. The biggest impact I would say that it has on the way I treat is that the way TMR is designed, you can't help but look at the human body as one complete functional unit. In the physical therapy literature, for example, there's a lot of talk about regional interdependence. When you're treating with TMR, no matter what the patient presents to you in the clinic, whether it's a shoulder issue or back pain or their ankle hurts or their knee, what have you, you're going to look at the entire body. And within a few minutes of doing, let's say, a full body movement assessment, you're going to identify areas in the body that need to be addressed, regardless of what the patient's complaint is. So, one of my favorite examples is treating a patient's tennis elbow, and after doing a full body movement screen, finding out that the area of greatest restriction and the area that had the greatest impact on this patient's symptoms was an ankle problem. And by doing an exercise that loosened up the ankle, I was able to decrease the patient's tennis elbow by, I think it was 75, 80%, and certainly increases grip strength on the dynamometer by 50 pounds. And that was just the first treatment. The other thing about TMR that is so important is that the methodology requires that you assess the patient, you intervene with the patient, that is, they perform one of the exercises, and then you reassess to see what the impact of the exercise was. And in doing that, you get immediate feedback as to whether or not you're on the right path in your treatment with the patient. And it really is a concept that we should be applying as physical therapists or any kind of clinician, no matter what technique or approach we're using when treating a patient or client. We need to assess, we need to treat, and then we need to reassess to evaluate how, effective our treatments are. The other thing that does is it shows the patient right away what kind of impact and positive effect you're having on the patient's condition with your treatment. And that gets you buy-in right away with what you're doing. The advantage of TMR is that it's easy to learn, it's easy to implement. The applications of the approach, it can be a standalone treatment or it can be an adjunct treatment. You can apply TMR concepts to techniques that you're already using. It's very versatile, and really the advantage of the TMR approach is it's limited only by your, let's say, lack of imagination, so to speak. You can be as creative with it as you want to, and you're going to be pleasantly surprised by the kinds of results you get. I have one story that it's one of my favorite TMR stories to tell, and I think any therapist who's been doing TMR for let's say at least a year or two probably has a similar story. But this is a little bit of a case study. About 9 or 10 years ago, a friend of mine from East Europe, her father-in-law was visiting for 2 weeks. And while he was here, she wanted me to treat him. He was in a situation where back home, where he came from, he had hurt his shoulder. He had had surgery, and it was kind of a workers' comp situation. He wasn't really responding to treatment, and there was even talk that he was going to be retired early with disability. So while he was here, my friend wanted me to treat him. So I treated him 2 or 3 times a week for the 2 weeks that he was here. And while I did some other things, TMR was definitely the framework of my treatment. I'm happy to say he responded very well. He went home, he got better, and he was able to return to work. But that's not the story. The story is that while working with this gentleman from Eastern Europe, my friend had to work with me because he didn't speak English. So everything I taught him, she had to interpret for him. And while he was here during those 2 weeks, she helped him every day perform his home exercise program. You might even say that she made him do his home exercise program every day while he was here. And in the process of those 2 weeks, not only did he get better, but she learned the TMR approach very well. So later on, when her son, who at the time was a competitive tennis player, hurt his shoulder, she treated his shoulder successfully. And when her husband, who worked in an auto body shop, hurt his back and shoulder, she treated him successfully. And her husband, who was impressed with his wife's newfound physical therapy skills, referred his brother to her. And I don't remember what the issue was, but she treated her brother-in-law successfully. And her brother-in-law was so impressed with her that he referred one of his friends who had already been to physical therapy and failed. He referred his friend to this woman that I know, and she helped him too, and he got better. So she treated 4 people successfully with TMR. Now, granted, this woman is brilliant, no question about it. She probably has an IQ of maybe 3,000. I don't know, but she's brilliant, but she doesn't have a medical background. So if this person without a medical background can have that kind of success with TMR, imagine what you could do with your background and your clinical expertise. I honestly think, and there's nothing in it for me, but I honestly think that every clinician of every stripe, whatever your discipline is, whether you're a physical therapist, a chiropractor, a physician, an athletic trainer, what have you, you owe it to yourself to at least take TMR level 1. I think that you will be very happy with the results that you get in the clinic, and it will spurn your interest to want to learn more. Good luck.